Hey everybody, it's your girl Trish, and I just wanted to have a little chat today about what it's like being a nurse working during this COVID pandemic. So, currently, today is March 27th, and we have surpassed China in the amount of positive COVID cases that are here in the US. And it just adds another layer of uncertainty and not knowing what's going on. But luckily, we have some policies that we're implementing in hospitals to hopefully prevent the spread. So, number one in the US, what are we doing? How are we protecting ourselves? I work in Southern California at a big center, and while our supplies are limited, we are trying to protect ourselves by using the CDC guidelines. So, what the CDC has said about protecting ourselves is that because COVID can be transmitted through droplets in the air, we're using a gown to protect our scrubs, we're using a mask and a face shield. And while we're running out of supplies, we are implementing things such as using reusable goggles instead of a face shield, with like the suction on the side. We're also moving towards sterilizing and reusing N95s through UV technology. I don't know how that's going to play out. That was just a new announcement told to me today in our emails, but hopefully that's something that can get done. Some people are using bonnets, which is the thing that protects your hair, but it's not in the recommended guidelines per se, like as an official guideline, because they're saying that the droplets for COVID are very heavy, so they fall a lot faster. So the only thing that really can be in contact with you is like direct contact, and then it will spray to the front of your body, any particles, rather than kind of floating in the air. Even though there has been a few studies, they can't confirm that it lingers in the air for how long. So they're saying right now that the particles are heavy, but I have seen some articles about that. Where do the patients go? They come up from the ER, they get tested. Our test kits now, I think, are running at a pretty fast speed. The rate of kind of seeing if someone's positive is, I think, 24 hours. Don't quote me on that, but I think that's what our center is doing. Is it's a 24-hour to see if a patient is positive, and they go on isolation for that time when we are even testing them, just so in case they have it, we're already ready. But they'll come through the ER. We'll send them up to, depending on how sick they are, the sickest patients go up into the ICU. Sometimes they need ventilators and other equipment, depending on whatever comorbidities they have. But there's also people who get out of that and may have been positive, who are on medical surgical floors. So they're not as sick as people in the ICU. And there's also people that we send home, that they're sick, but they're not really that symptomatic, so they're on home isolation, and they're being checked on, and they have obviously some follow-ups. They're not just sending them home without any recourse. So there are some resources for those people that go home as well. Okay, so the last part of this video is a little kind of scary, and it's a little bit real, but just kind of wanted to say for the people who aren't social distancing or maybe not taking COVID seriously, it's because you haven't been into a hospital. A lot of the people that come in with COVID that end up being in the ICU have something crazy like an 80% mortality rate. And yes, they may have comorbidities, but some people are healthier than you think. And it's just a matter of kind of a lot of things that are going on. But to just put it into perspective, you're in the ICU and you're all alone because we're not allowing families to visit. These patients, they're intubated, meaning they have a tube down their throat, they're having a hard time breathing, and sometimes we put them on like 100% oxygen. We breathe at 21% oxygen in the air, so 100 is a lot. And they need all the help they can get for their lungs. So sometimes these people, they have to be paralyzed so that their lungs will breathe at the rate of which we want it to with the vent. Sometimes they have blood pressure medications, more than one, two or three, and not the ones that you take at home. They're the IV ones that can basically they are vasoconstrictors, so they constrict your blood vessels and they can cause your extremities, your hands, and your feet to turn really dark. You aren't getting enough blood because we want the blood to go to the vital organs. It's really scary, especially for the healthcare workers when people like them have to have CPR being done, because now it's like you're exposing so many people and you need so much equipment in one room. You need the crash cart with the pads and the medications, and you need different doctors there, a pharmacist, a doctor, or one of the charge nurses to run the code. You have people there pushing meds, people there doing CPR, a respiratory therapist. Depending on the other conditions, you have other nurses who are running around and helping, all in this one small tiny ICU room. And if you pass alone. So that's the scary part about it, and that's the stressful part about COVID. And I always encourage people to stay home, stay safe, and just look out for your healthcare workers who are really trying their best. There's so many healthcare workers who have been affected by COVID, whether it be something simple as I tested positive, I'm staying home, to healthcare workers who have passed away from just trying their best to help out and be there for patients, and for people who need help until their last days where they succumb to the disease. To protect our patients, we've been doing a no visitor policy, and I know that can be really hard for some families, so my center has implemented Zoom or Skype, especially for patients who are intubated or can't really speak. And that's really the biggest things that we are dealing with. Protecting ourselves, I work in a surgical ICU, but we also have another ICU in our center, and that ICU is taking the brunt of the COVID cases, and any high-risk patients that they have been transferred to my unit. So people who are awaiting lung transplants and things like that, people who are immunosuppressed but need ICU care. Mostly, for the most part, come to my unit and we'll take care of them. But that's not to say that we haven't had any rule-out cases on my unit. So on my unit, we've had rule-out cases for people who have been in the hospital, but maybe did not come in during the peak of COVID, and they're just being tested just in case because they have other comorbidities or conditions that the doctors think need testing. And so it's kind of interesting to see how it's evolved, but I think the biggest thing is that our leadership and higher ups have been so awesome at communicating that every day there's kind of a new policy on how we're protecting our staff, first of all, but how we're also helping protect our patients and reduce the transmission in terms of like reducing contact, or whether that be any medications or things that the patients have had in their room, things that we think that need to just stay with that patient if they may be a rule out or are positive, if that made any sense at all. But for the most up to date, you can check this information on COVID. Go ahead and check out the CDC or WHO. But also, if you just want to know more about specifically what it's like to be working in the hospital during that time, or how the day typically goes, I will be able to speak on that and just that, but drop your questions down below. And I hope that this was short and sweet, but I just wanted to update you on how kind of crazy it is, but what we're doing to prevent things like this. So, okay, see you guys in the next video.